Welcome back. I'm going to talk a little bit about the DSM-IV, and you have some slides that you can look at as I talk about some of these things. With the DSM-IV, this is basically our Bible for psychiatry for mental health. It's the initials actually, or the abbreviation stands for the Diagnostic and Statistical Manual of Mental Disorders. We're up to our fourth edition right now. Actually, it's the second fourth edition because we had one fourth edition and then another fourth edition that had what's called the text revisions throughout, which they updated some of the information in terms of the literature, the research, and that sort of thing. But they didn't change any of the diagnostic criteria for any of the disorders. So the red book is the DSM-IV, the silver book or gray book is the DSM-IV text revised version. Either one of those versions would be fine to use for this class because you're looking at primarily the diagnostic criteria. If you're looking for demographics and things like that, you would need probably the newer version. But you can find some of that information on the internet in journal refereed sources as well. But again, DSM-IV stands for the Diagnostic and Statistical Manual of Mental Disorders. We're the fourth edition. We should have the fifth edition coming out in a couple more years. It basically follows a medical model. So we're looking at trying to develop criteria to help us define diagnostic categories. So, in a sense, we do that in the medical domain. I mean, we want to do this not because we want to just throw out labels here and there. We want to understand what we're dealing with so we can choose the most effective intervention. We wouldn't, for example, treat cancer with a treatment protocol designed for congestive heart failure. There's a disconnect there. So we want to know what we're dealing with so we can choose the most evidence-based, most research-supported intervention possible. So in the DSM-IV, you have hundreds, literally hundreds of diagnoses. You have 17 categories, umbrellas is what I call them, with several diagnostic domains underneath those umbrellas. So one category would be called anxiety disorders, and under anxiety disorders you'd have generalized anxiety disorder, panic disorder with or without agoraphobia. You'd have obsessive compulsive disorder, just a whole host of anxiety disorders that would fit under that domain. Mood disorders is another umbrella or diagnostic category, one of those 17 categories I just mentioned. Under that, you would have major depressive disorder, dysthymia, bipolar 1, bipolar 2, and cyclothymia. So you've got the 17 categories, but you've got all these other separate diagnoses under these umbrellas. And so there are 17 altogether. And in the DSM-IV, you have 5 axes. Axes 1 and 2 hold all your psychiatric diagnoses, all the 17 categories. Basically, 16 categories go on axis 1, and on axis 2 are the personality disorders. And that's kind of where we're going to spend most of our time in this class, is talking about when things go wrong, what do we call it? When there's a personality flaw or set of flaws, when there are disconnects in terms of personality development, what do we call it? What are those disorders that are listed in the DSM-IV? So on axis 2, that umbrella, the one of 17, goes under axis 2. And just a couple of diagnostic subcategories. Separate diagnoses go under axis 2 as well. They're grabbed from the 16 umbrellas. Just 2 are grabbed from the 16 umbrellas and placed on axis 2 along with personality disorders. One is mental retardation and the other is intellectual borderline functioning. And one set of authors has said that distinction took place. Why have 2 separate axes for all your psychiatric diagnoses. And these authors said, well, that's we wanted to put on axis 2 the conditions that were the most resistant to treatment. And they figured personality disorders are pretty resistant to treatment. Obviously, mental retardation is a good example of something that's very resistant to treatment. I mean, I couldn't take someone who would be diagnosed with severe mental retardation and in a few sessions have them up to an IQ of 120. That just would not happen. So that's the theory, is that, or the explanation, is that division between axis 1 and 2 is because axis 2 are the treatment-resistant conditions. But that only goes so far in terms of logistics, because you could certainly argue that some psychotic conditions like schizophrenia would be very, very treatment-resistant. Why wouldn't that be listed on axis 2? So the arguments aren't perfect. But basically, we have 16 categories that go in axis 1, one category that goes in axis 2, personality disorders, and a couple subcategories that go on axis 2, mental retardation, intellectual borderline functioning. The third axis is refers to medical conditions. And the question is, do we list all the medical conditions that a person has under axis 3? And the answer is absolutely no, we do not. I often ask my classes when I teach this course, would you list acne under axis 3? And the answer to that question is yes and no. It's really maybe. Because what you list on axis 3 are the medical conditions that exacerbate or contribute to the psychiatric conditions. So if I had acne and I was diagnosed with major depressive disorder, and the fact that I had acne actually contributed to my depression, yes, then I would list it on axis 3. But if I had acne and that had no relationship to anything on axis 1 or 2, I would not list it. So yes and no. You have to make a clinical judgment as to whether you'll list a medical condition on axis 3. Axis 4 are your psychosocial, environmental variables. So, for example, let's say again I had major depressive disorder on axis 1, and I was having significant distress at work, at my job. I could list occupational under axis 4, occupational category there, because that would be contributing to something going on axis 1 or 2. So occupational things, financial, if I was in financial trouble, that would certainly be a environmental variable that I could list on axis 4. So axis 4 are your psychosocial, environmental variables. And finally, axis 5 is a global assessment of functioning. It's just a score between 0 and 100. 0, you're not doing well at all, and 100, you're doing perfectly well. And you wouldn't expect anyone in the high 90s or 100 even coming in for treatment. You'd expect a lower number. And you can actually use the numbering system in different ways. The highest level of functioning in the last year, your current level of functioning, you give it a number. Or you could say functioning at the time of admission, functioning at the time of discharge. You can choose what category you want to use and then give it a number. So those are your five axes. And again, this is our Bible that we use to help us come up with the best diagnostic evaluation that we can regarding your presenting condition, so that we can then in turn select the best intervention that we possibly can.